Hi, Dr. Q. My name is Nick. I am one of the pharmacy interns here, and I just wanted to take a few minutes to respond to your inquiry about different agents that could be used for the management of hemodialysis-induced hypotension. So, after checking a variety of different sources and guidelines, I found that the most widely used agent for treating hypotension caused by dialysis is midodrine. Other medications that have shown an increase in systolic and diastolic blood pressure in this patient population include sertraline and L-carnitine. A few other drugs like caffeine, ephedrine, and epinephrine can be used to treat dialytic hypotension, but they are non-selective agents that can cause cardiac side effects like tachycardia, arrhythmias, and aggravation of coronary heart disease, so they aren't recommended as pharmacologic interventions. Similar to those agents are vasopressin analogs like desmopressin. While one small study did show that there were significantly less hypotensive episodes that occurred in the vasopressin group compared with a placebo group, these agents have not been seen in guidelines for use in hemodialysis-induced hypotension. Anyways, back to the recommended agents. First off, as I alluded to, we have midodrine, which is a well-known and accepted drug used for acute and persistent forms of dialysis-induced hypotension. According to the National Kidney Foundation KDOQI guidelines, a single 5 milligram dose of midodrine administered 30 minutes before a patient's dialysis session was associated with an improvement in intradialytic and postdialytic blood pressures. More specifically, one systematic review published in the Nephrology Dialysis Transplantation Journal found that in a study comparing midodrine treatment versus control, post-dialysis systolic blood pressure was higher by an average of 12.3 millimeters of mercury, and diastolic blood pressures was higher by an average of 7.3 millimeters of mercury. While the guidelines recommend a 5 milligram dose 30 minutes before dialysis, the dosing regimens in this study ranged from 2.5 milligrams to 10 milligrams, and that was given 15 to 30 minutes prior to dialysis. It should be noted that the drug is well tolerated and safe. Few adverse effects that patients can experience include painful urination, itching, and paresthesias. Another drug effective in prevention of dialysis-induced hypotension is sertraline. While primarily used for psychiatric disorders like depression, sertraline is also associated with an improvement in hemodynamic parameters in patients with intradialytic hypotension, or IDH. A randomized crossover clinical trial of sertraline for IDH showed that sertraline significantly increased both systolic and diastolic blood pressure during and after dialysis, and also significantly reduced the risk of hypotension episodes by 43%. It is important to note, however, that not all patients may benefit from sertraline, including patients with comorbidities such as diabetes mellitus. Side effects of sertraline include dizziness, insomnia, fatigue, somnolence, and headache. Lastly, L-carnitine can also be used for hemodialysis-induced hypotension. Although the reasons for its beneficial effects are not clear, one multi-center trial of 20 milligrams per kilogram intravenous L-carnitine therapy administered alongside dialysis was associated with reduced frequency of IDH, 44% compared with 18%. So I hope that was helpful. If you have any other questions, please don't hesitate to page me at beeper 2468, or you can give me a call at extension 8642. Thanks.